Hi, I'm Metta Spencer. I'm in Toronto, and I have two friends with me who are in very different places. Laura Kahn is a physician and a public health expert, professor of public health at Princeton University, and she's sitting at her desk, I presume, at Princeton. And Dr. Ronald St. is in Florida having a vacation. And he is also an epidemiologist. He's been very much in charge of the Pan-American branch of the World Health Organization. I don't exactly know what the title was there, but I do know that during a very important period of time, he was in charge of managing the SARS epidemic in Toronto, Canada. So he and Dr. Kahn have no doubt many things to say to each other. Laura, will you say hello? It'll bring your face up for people.
Sure. Hi, my name is Laura Kahn. I'm a physician, as Metta said, and I'm a research scholar here at Princeton University.
Perfect. And Ron St. John, let's see your face.
Hi, I'm Ron St. John. I'm also a physician, trained as an internist, infectious disease interest, but had a career in public health, specializing in epidemics and disease control programs with WHO, CDC Atlanta, and in Canada as well.
Yep. Okay. So we have two world-class experts here, and I hope they are on the same page. Or in fact, if you disagree, that's just as good. You'll have a good time. I don't know what there is to disagree about it, but I do know that I am very much involved with Project Save the World, and part of it is we have these 6 global threats that we're trying to address, and we think that all of them need to be addressed at once, and they can best be addressed together, comprehensively, because many of the same issues are involved with them. But one of our global threats is pandemics, and we have 2 planks in our platform for survival, which you'll see on our website. One of them has to do with the use of the application of the concept of One Health in addressing infectious diseases, or I guess any other diseases. And the other has to do with the desirability of adopting worldwide a system of management called incident management system. Both of these are our key platform proposals for saving the world. So we think this is pretty important. And as it happens, both of our speakers here are very experienced in dealing with both of those issues. Laura Kahn has written a book called One Health, and another one called Who's in Charge, about incident management or in handling crises in public health. So, and Dr. St. John has done the work of actually addressing such a crisis, a major one. Now, what drew me into looking up Dr. Kahn is that I was one of the things that we had not covered in our platform that I thought should be covered has to do with the problem of antibiotic resistance. That we've got a situation where we're running out of antibiotics that are able to control new bacterial infections. And her book on One Health does address that. So, Laura, would you be so kind as to start us off with a bit of a discussion about this antibiotics resistance problem and why we should be worried about it. And Ron, please jump in at any time if you have thoughts about this. And then in a little while, we're going to turn our conversation, if you will, over to a discussion of the problems of managing public health crises. Okay, what's the story?
Yeah, well, so let me just start. Thank you, Metta. Let me just start by telling your listeners what the One Health concept is. One Health is a relatively new term, but an ancient concept that human, animal, and environmental or ecosystem health are linked. It's very simple. Human, animal, environmental, or ecosystem health are linked. Now, this might seem obvious, but it's generally not how our institutions and infrastructures and funding streams function. In most cases, we focus solely on humans for obvious reasons. We're human, but we don't generally, our policies generally do not recognize the interconnectedness between our health, our lives, and the lives of the other species that we share our planet with, and the environment and the ecosystems in which we live. Now, with that, this concept then serves as a very useful framework for analyzing and addressing complex issues such as antimicrobial resistance. Now, antibiotics are the foundation of modern medicine. Without having safe and effective antibiotics, many of the treatments that we take for granted in modern medicine become too risky to do because the risk for infection becomes too great. So, for example, the use of elective surgeries, cancer chemotherapies, immunosuppressive therapies for autoimmune diseases become simply too risky to do because the risk for infection becomes too high if we no longer have functioning or safe or effective antibiotics. So this really is a crisis. And there's a lot of controversy. My book, One Health and the Politics of Antimicrobial Resistance, looked at the use of antibiotics in humans, in animals, and their impact on the environment. Here in this country, there's been a lot of controversy about the use of antibiotics, particularly in animal agriculture, for a variety of reasons. And I could take up a whole hour talking with you about the history of why these antibiotics were used, why they started to be used in animal agriculture. And you have to back up and look at what was going on during the mid-20th century during World War II. I don't think I have time to get into it.
No, but let me ask you a few questions, because I did read your book, that book about antibiotics, and I found it fascinating. And the thing that surprised me most and made me curious is that I had heard already that doctors were too free about dispensing, antibiotics. And therefore that people are developing resistance because they're being used inappropriately. What surprised me was the emphasis that you placed in the book about the seriousness of using antibiotics as a means of fattening up or enlarging the meat production of the animals that we use for food. And I had not realized how serious that was. Can you explain why? For one thing, I wonder, in what way does an antibiotic make an animal grow faster or heavier?
Right. Well, let me just preface this by saying that antibiotics are really a linchpin, not only for modern medicine, but for modern agriculture too. There's a lot of parallels between modern medicine and modern agriculture. And I just want to emphasize that you can demonize agriculture, but we must recognize that while antibiotics are the foundation of modern medicine, agriculture and the food security that it provides is the foundation of civilization itself. So these are both very, very serious issues. And if we want to have a modern society, we need to have functioning antimicrobials, and we need to have agriculture and food, because you cannot have civilization without it. Mm-hmm. So that having been said, food security should be first and foremost in everybody's concern, not only because of the use of antibiotics, but because of the threat by climate change. Climate change threatens agriculture and food security all around the world. And that should be first and foremost in everybody's mind and concern. So we cannot take any of these things lightly. Now,
actually, that sort of emphasizes our point in the Project Save the World, that many of these threats are interrelated, and certainly famine is one of our 6 global threats.
Right.
So if we don't pay attention to food security one way or another, and also global warming is another of our major threats. So
That's right.
we have to address them all together. I would
That's
agree.
right. You can't stovepipe them. You have to look, and that's why One Health is so useful, because you use this concept to address these multifaceted problems because they're all interrelated.
Mm-hmm.
Now,
If I may, can I just inject one quick thing?
Sure.
Going back to what you said, Laura, about the importance of antibiotics, people forget what the practice of medicine was like before antibiotics. And it wasn't that long ago. And everyone should be aware of, in my opinion, and should read about the first use of penicillin and what a miracle it was. One of the first cases ever documented was a woman who was dying of a streptococcal infection after delivering a baby. Mm-hmm. And she lingered for months, dying slowly, bit by bit, until the first bits of penicillin were shipped from Princeton University up to Yale University, and she was given a tiny dose of penicillin, and the next day was able to get up out of bed. And, you know, that is the miracle of antibiotics. We have to remember that and not lose the miracle, as you're saying.
Yeah, absolutely.
So how can we save the darn things? Looks like, I mean, you make a statement in your book that some people think that we're at the end of the age of antibiotics. Well, that's an ominous statement. What can we do to preserve the use of these and get new ones?
I think, you know, part of the problem is they've been the victim of their own success. They've been hailed as a wonder drug for so long that people use them for everything. And in many countries, they're available over the counter. And people, once they get a sniffle or a bellyache, they'll immediately go and buy antibiotics. In some parts of the world, antibiotics serve as a substitute for primary care and sanitation and hygiene. And that just simply cannot continue. We also are burdening, are polluting our environment with all of our massive waste, and that includes fecal waste. And there's one study found that they estimated that the amount of fecal matter produced by all of the livestock in the world is on the order of trillions of kilograms per year. And we're not really adequately addressing that. So in some countries, particularly those where there's open defecation, they're living in such a microbial dense environment that people are getting sick, children are getting stunted, and antibiotics are being used widely. And this country that stands out is India, because 600 million people are openly defecating. They've got all these wild animals and domesticated animals defecating. They've got some of the most resistant bacteria in the world. And they use antibiotics over the counter, and these resistant microbes are spreading around the world, and they are sharing their resistance genes. So it's a huge threat. So it's a many-faceted, complex problem that we need to be talking about and figuring out how to address it. Now, the Indians, to their credit, recognize this, and they're trying to do something about it. But it's an enormous challenge.
If you'll allow me just a little anecdote, personal anecdote to back up what you're saying, Laura. When I was a very young doctor, it was quite a while ago, I had the opportunity to live and work in Bolivia. And it didn't take me long to realize that I could treat people who had diarrhea every day over and over and over again. But once you put in a water supply system, that problem went away.
Right.
Because of clean water and lack of pollution?
Yes.
Yeah. Strict sanitation systems are essential. If we want to get ahead of this antibiotic resistance problem, you have to have clean water, and you have to implement a food safety program. I mean, not only should we be concerned about food security, but food safety, to make sure that food is not contaminated with fecal matter, because that's what helps to drive these illnesses. So, you know, with all the fecal matter that's being produced in the world, we really need to get a handle on it if we want to have a sustainable society in the future with functioning antibiotics.
Okay, maybe I'm driving this in the ground, but what surprised me so much was the notion that there are these tons and thousands of tons of antibiotics being fed to animals just to make them heavier and more profitable for the grower, for the farmer. Now, you say we've got to, and you are very frank about saying we need to respect the needs of farmers and the market. What's the requirement to be able to sell their produce or their meat products. But there's a whole thing about the politics of trying to curb the practice or outlaw the practice of feeding antibiotics to animals, not for any medical reason or veterinary health issue, but just to make them heavier.
Well,
and yeah, now what are we going to do about that if that is as big a problem as you seem
right.
as
Well,
I'm reading
let me just say that there's a historical reason for that. And during World War II, so animals, in order to build meat, need to have a protein source. And it's either, the US either got fish meal from Japan or cod liver oil from Norway. Those supplies dried up. We had to feed not only our soldiers and our population, but Britain too. And the animals just weren't getting the protein that they needed. So the government was desperate to find an alternative. This one researcher, Dr. Thomas Jukes, was sure that it was going to be vitamins. So he started doing experiments on animals, testing for using vitamins. And it turned out that it wasn't the vitamins that were making the animals grow more and reduce their death rate. It was the antibiotic residues that were doing that. They weren't really sure why this had this impact, and we're still not entirely sure why antibiotics have this effect. The theory is either a reduction in inflammation in the gut, or most likely it reduces some bacteria that might be inversely taking some of the nutrients away from the animals. But regardless of the mechanism for how they work, what the end result was a dramatic reduction in the death rate of the animal and an increase in the growth rate of the animal. It was so dramatic that it was quickly adopted around the world. Now, at that time, antimicrobial resistance was more of a theoretical threat, and food security was a very real, immediate threat. Mm-hmm. Now in the 21st century, our concern is more about antimicrobial resistance. It's a very real threat. Food security is right now more of a theoretical threat, although, as I'm saying, climate change is going to make that threat more of a reality as the planet heats up. Mm-hmm. So we've got more of a theoretical threat now. We have an actual threat. We need to figure out how to raise meat without antibiotics. And in some places in the world, Europe, they implemented a complete ban on growth-promoting antibiotics. The country with the best data that I analyzed was Denmark. Denmark dramatically reduced their use. However, it must be said that no ban in Europe included coccidiostats, which are anti-parasitic drugs often used in poultry production. No ban included that. There's no counterpart in human medicine, and you simply cannot raise thousands of birds together without them getting sick with this parasite. You absolutely have to have this anti-parasitic drug. And so that was not banned anywhere in Europe. The challenge, though, is to raise animals without antibiotics is you have to have a very clean environment, and that is not, pigs and other animals are not the most fastidious of creatures. They defecate everywhere. And so to keep a very, very clean environment is not an easy thing to do on the farm. And these animals are, you know, vulnerable to getting sick. So when they do get sick, the challenge then is you have to give them antibiotics because they're sick, and then you have to give them therapeutic doses, which is much higher. So sometimes when you're banning the low dose, you wind up using high dose because the animals are getting sick. Animals did not evolve to live in close concentrated quarters with each other with lots of fecal matter all around. But if you want to have affordable meat for everybody, that, you know, the economy of scale forces a lot of producers to have those types of facilities. So
well, I have to say that when I finished reading your book, I was actually more depressed than when I started, because it seems to me that you've posed some real challenges that I didn't see any very promising solutions to. Now, clearly, I would think one of the things that we need to focus on is trying to give some heroic effort, I mean, worldwide effort, to fund research on finding new antibiotics so we're not in deep trouble. But that is not by any means the only, or maybe even the first thing that you were emphasizing. If you're in charge, let's put you in charge of stopping this whole antibiotic resistance problem, and we are now making you queen of the world, and you're able to issue an edict to solve the whole thing tomorrow. What will your 3 or 4 top edicts be?
Well, if I had unlimited funds, I would give every country state-of-the-art sanitation and clean water and clean food. That would dramatically reduce a lot of disease. That would be first and foremost what I would do. Second, I would emphasize more vaccine development. It's much better to prevent disease than to treat it. Some of these diseases can be prevented. Of course, you know, you're dealing with some people who are against vaccination, but really vaccines are the greatest breakthrough that we've had in the history of medicine and public health, is the prevention of disease. And I think we could be doing a lot more with basically vaccines are boot camp for the immune system. It's helping the immune system to see what the pathogens are and to be able to attack it by themselves. Thirdly, of course, we want to have new antibiotics and new antimicrobial therapeutics. I happen to be a big advocate for bacteriophage therapy, which is bacteriophages are the most prevalent bioform on the planet. There's a lot of advantages to their use. Antibiotics not only kill off the bad bacteria that you want to get rid of, but they also kill off the good bacteria. And as we're learning with more and more with the microbiome, we're discovering that our health is that the microbes that live in us and on us are as important to our health as any organ. So antibiotics have the collateral damage of killing off a lot of the good bacteria, and they've been now associated with some chronic diseases. And I highly recommend all the readers read Martin Blazer's book, The Missing Microbes, and he's attributing some of the chronic diseases like obesity and autoimmune diseases, food allergies, to the widespread use of antibiotics. So they have been a magic bullet, to be sure, but they have, you know, they have come with their own problems. Yeah. And we need to recognize that and reduce our dependence on them as much as possible. In other words, we need to work with nature, not against it. The natural foe against bacteria are the bacteriophages. They have challenges certainly in and of themselves. They're highly specific, which has its pluses and minuses. You'd need to have much better rapid diagnostics, which would need to be developed. But I think in the long run, it would be more sustainable and healthier to use phage therapy than rely solely on antibiotics.
That is fascinating. There was a number of years ago an article in the New York Times Magazine about phages in Russia or someplace, Eastern Europe. Okay,
so Metta?
yes.
Metta,
Yes.
So basically, there is no magic bullet that you're looking for.
Okay.
It's a combination of measures. Some are very difficult, some are still unproven, but there's a combination. Some are well known, but it's a combination of things, and we need to apply what we know and apply it better.
Yeah. Well, you know, now we've done about half our time already, and I haven't even gotten to what I think is the main course, and that is the opportunity for you two to compare notes, because Laura says she's already addressed Ron's work in a way in her book Who's in Charge, by talking about the SARS epidemic. So I'm going to be quiet as you people have a conversation about your common interest.
Well, if I may start, when Metta first approached me about this whole thing about pandemics, my first operating premise was there will be pandemics in the future, not if, but there will be at some point in time. And I think it should be clear for people who listen in what a pandemic is. And in simple terms, for me, it's an outbreak of disease that gets bigger and bigger and bigger until it begins to involve multiple regions of a country, multiple countries, and it can be actually global, like influenza is every year. So that's a pandemic. And in a sense, we have a pandemic every year with influenza. It goes around the world, in northern hemisphere, southern hemisphere, we have it. And to me, the important thing is we're not going to stop those pandemics, but we need to manage them better. And the management issues are often difficult. To give you an illustration, there's an Ebola outbreak going on right now in the northeastern part of the Democratic Republic of the Congo. And when you talk about let's manage that outbreak, let's stop the transmission of Ebola. Well, right now there are something like 30 to 35 organizations involved in responding to that outbreak. So it begs the question, how do you manage 35 organizations in a coherent and comprehensive and efficient manner so that you can stop an outbreak as fast as possible? And that's why something called the incident management system, which was developed by safety personnel, firefighters mostly, has been proven to be an effective way of bringing together the people, the money, and the logistics to manage an outbreak effectively. And I think the important thing that we're trying to promote is to get every country to have a capacity for incident management.
Those would be individual countries. And if you have a pandemic that goes across countries, how about incident management systems that are integrated at the international level?
Well, here we expect and hope that the World Health Organization, which is the international body that oversees international health, will be a key fixture, a key incident manager, if you will, and that countries will cooperate through WHO for the efficient management of an outbreak. In other words, the wealthy countries will provide resources. Sometimes there's a history of countries bypassing the World Health Organization, even bypassing the national government because of certain interests that they have. But in general, that would be the operating principle would be that the World Health Organization, as a United Nations organization, would be the overall incident manager.
Mm-hmm. Laura, in your book, you talk a lot about the politics of pandemics or of more generally health crises, including bioterrorism, which I think is worth mentioning.
Well, let me just jump in here and that the two examples that Ron mentioned, influenza and Ebola, both are zoonotic, meaning that they're diseases of animals that infect people. Pandemic influenza generally come from wild waterfowl, and they can get our domestic fowl sick. The Ebola virus is believed to be from fruit bats. recently was discovered in a bat. And so these pandemics that come are either directly or indirectly related to our quest for meat. That is either our domesticated livestock or eating wild animals, also known as bushmeat. So many of these emerging diseases that you're describing, these pandemics, are related to what we're doing. They're related to agriculture. So while agriculture is the foundation of civilization, it is also unleashing lots of diseases upon ourselves. Mm-hmm. And so the great challenge that we face is figuring out how to provide animal proteins to feed upwards of 9 billion people on the planet in a warming world sustainably. That's the great challenge that we face. Otherwise, we're going to continue dealing with these outbreaks in an emergency basis, kind of like a whack-a-mole strategy of whenever an ugly disease raises its head, you have to whack it to try and put it out. I mean, there's no grand strategy here. It's just response. We need to think strategically of how are we going to have a sustainable global civilization and provide, animal proteins or proteins to meet our nutritional needs. So
what about these, production of meat in vats? Because I've been interested. I eat meat, and I'm not going to give up eating meat. I'm sorry.
Most people are not. No,
yeah.
I'm just not a vegetarian either. And I didn't suggest that we become vegetarian. But what I'm saying is we need to figure out how to.
I know. But there are a lot of other reasons. Now, if the arguments for being a vegetarian are very compelling, because I've just been looking at desertification as a problem. And a lot of those barren wastelands, even deserts, millions of miles of desert, are caused by the fact that the animals overgrazed and denuded, ended vegetation there. And so the first thing they have to do to restore land is to get the animals out of the way. So here again is an extra reason. Now, if we had this business of growing meat in vats, and I guess that's coming up in another few years, can they do that without antibiotics and without some of the other risks that are being involved?
Well, yeah. I mean, if you raise meat in a laboratory, you're not dealing with fecal matter. You're not trying to keep animals healthy, so that negates that problem. Mm-hmm. The challenge is to scale it up to a size that's going to feed billions of people. Mm-hmm. That's going to be, and right now, technologically, we're not at that level. So yes, there are alternative strategies that we can do, but
okay. Now, it seems to me that Ron is, let's not put down whack-a-mole, because Ron is main guy in charge of whacking the moles, and he's been whacking moles.
Somebody's got to do it.
Somebody's got to do it, and he's whacked very effectively. I think you've also whacked Ebola, haven't you, Ron, to some extent, as well as SARS?
Well, I was actually, it was kind of interesting. I've always worked in Latin America through the WHO office in Washington, D.C. And when the big outbreak of 2014 to 16, where there were 11,000 cases of Ebola, something like that, occurred, and a case of Ebola showed up in a Texas hospital and infected 2 nurses there. That's when the Latin American countries all of a sudden sat up and said, oh my gosh, we do have travelers moving around the world, and travelers can bring disease. Are we prepared for Ebola? And that's when the Pan American Health Organization asked me to be, for them, the first ever incident manager for what we called Ebola preparedness. And it was urgent. We didn't have any outbreaks of Ebola in Latin America. We didn't have any cases, but we did have a situation of, well, answering the question, are you prepared? The answer was no. But we took measures to improve that preparedness. So that was I did not experience directly I have no experience directly with the Ebola outbreak in Africa, but we had some of the same concerns. Were our hospitals prepared? Would we transmit Ebola? If a patient turned up in a hospital, would everybody in the hospital get Ebola? Those kinds of questions came up. And so we had, for 3 months, an Ebola emergency preparedness incident management in PAHO. And as a result, that system has been adopted 100% by the Pan American Health Organization in dealing with the yellow fever outbreak in Brazil last year, in dealing with the measles situation in Venezuela. A whole bunch of outbreaks have now been what we're calling, what Lard nicely called whacking a mole. We're busy whacking moles in Latin America using the incident management system.
Mm-hmm. Well, until you get some comprehensive answer, you're definitely going to have to whack moles. My guess is you'll always have to whack some moles, won't you? They'll just be decreasing if we get more a plan to reduce the incidence of various diseases and the transferred diseases. I mean, you're also involved, Rana, as I recall, with the issue of transportation and the fact that people traveling around the world have a tendency to bring home things with them that we don't particularly appreciate. Maybe you want to mention that.
Yes, they're humans are great transporters of germs, to put it mildly. We're great vectors, and we travel more and more and more. There are IATA, the International Association of Airplanes, estimates that in another couple of years there'll be close to 3 billion passenger trips per year. That I say passenger trips. Now, some people make a lot of trips, but there are many, many people who make a trip to Costa Rica or to Dominican Republic or wherever for a variety of reasons. Sometimes it's ecotourism, where you go trekking into the jungles and you might get exposed to something interesting. There are people who climb mountains and do all kinds of things when they go traveling. So we are great at bringing back disease. Certainly in the United States at the present time, there have been multiple outbreaks of measles, it was eradicated in the United States, eliminated in the United States. But it's coming back because the travelers bring measles back. They're unvaccinated when they travel, bring measles back. You get these small mini outbreaks, currently about 35, 40 people in Washington, Oregon, because there are unvaccinated people in the country. So traveling is a major factor for spreading disease around the world. Mm-hmm.
Okay. You know, I read something, no, I didn't read it. It was on TV, I think PBS. Recently about an initiative run by the new organization called Ending Pandemics, which I think was founded by Larry Brilliant. And they are picking up on the use of, I believe, cell phones and other technologies for rapidly detecting outbreaks of new diseases in very remote areas. They can take a picture of a patient and maybe also the microscopic slide or whatever of their blood, let's say. Do you know anything about this? Is this a promising? I think both of you, I want to ask. Is this a promising method of early detection? And if so, what has to be done to prevent people from transmitting these pathogens from one country to another through international travel?
Well, certainly rapid, diagnostic using the cell phone to take a picture of somebody would be a great advance. But as I had said earlier, vaccines are our greatest strategy for preventing disease. And if you've got a vaccine preventable disease like measles, but people are refusing to vaccinate their children, you've got a very serious problem. Now, as Ron had mentioned, that we had eliminated measles in 2000 in the United States, but thanks to, vaccine conspiracies and misinformation. There was an article published back in the Lancet by a Dr. Wakefield using falsified data, linking the measles vaccine with bowel disease and autism. That was subsequently retracted, but the damage was done in public opinion, and it's been very hard to regain the trust of the public back to vaccinate their kids. And the problem has become so bad that the World Health Organization has now considered vaccine hesitancy, or the refusal to vaccinate one's children, as one of the great public health threats of 2019. I mean, this is one of our greatest interventions is vaccines, but if the people don't trust you, you're even having problems now in the Democratic Republic of Congo. They've got a vaccine against Ebola, but there's people are scared. They don't trust the authorities. They don't trust the vaccines. And it's been very difficult. The outbreak's been spiraling out of control despite the availability of an experimental treatment and a vaccine because of lack of public trust.
Okay, now let's see. Can we address that more head on? Because I spend a lot of time on Facebook, and I tell you, even among friends of mine, people I don't know too well, but nevertheless, they're not crazy. I still have sane people posting frequently the anti-vaccine kind of theory that this is a very dangerous thing. Now, I just think maybe we ought to have a much more public conversation about this and put this matter to rest. If we can convince, or you can convince, I'm not one, convince these people who are still resisting that this is stupid and they're really doing harm, I think you might make some progress. But I haven't yet come across a public debate about what's the evidence and what's the proof.
Well, in preparing I'm preparing lectures for my course. If you look at the data in terms of childhood mortality, infant mortality in the 1800s, before vaccines became available, sanitation, the mortality rate for children back then was over 50%. Most children did not make it past age 5 in the year 1800. You go to 2015, and now most children do make it out of childhood. They do make it into adulthood. And that is largely because of sanitation and vaccines and, modern medicine.
I don't think anybody questioned that, but if somebody says this vaccine will cause autism, I want maybe there should be some absolute proof that it doesn't. Or I don't know what else. What else do they claim that vaccines are causing? I don't know. What kind of dangers? Ron, do you know?
Metta, let me pose a problem for you. Okay? In a question. Who do you trust more? Your friends on Facebook or some doctor somewhere at some conference talking about what you consider esoteric scientific terms? When the Facebook mother says, I took Johnny down to get a vaccination, and he got a horribly sore arm and some fever, and I don't think he should have had that vaccine in the first place.
No. But if she says, I brought him home and immediately started showing signs of autism, then I want to say, okay, let's see if we got some proof that this didn't cause it.
No, I don't think that was a problem. But I think a lot of it has to do with the way people trust news sources. And people often trust, and there was some research on Facebook issues, people on these networks of people trust your neighbor or your friend on Facebook more than you tend to trust an authoritative figure. Now, public health has got to take advantage of Facebook technology and so forth.
But look, let's suppose, I agree, I think everybody's going to agree with Laura that childhood mortality has decreased over time, and this absolutely must have something to do with not only antibiotics, but vaccines and God knows what else. And thank Lord that we have these innovations, but that doesn't preclude the notion, okay, somebody's going to say autism has increased 1,000% at just exactly when when vaccines have been adopted most widely, and therefore, in fact, I took my kid to be vaccinated and she's now autistic. So I am, they're going to make that argument. And why is it that I haven't heard any specific refutation of that particular kind of argument? And I'm sure there are other things they're accusing vaccines of besides autism, but I know that that's one of them. And I've got an autistic person in my life that I am concerned about, and they don't think that's what caused it, but I hear that debate nevertheless.
Right. Well,
Sorry to make trouble for both of you, but there you go.
Yeah. Well, let me just say that before the vaccine, the measles vaccine became available in 1963, there were in the United States, there were 48,000 hospitalizations per year, 400 to 500 deaths, and 1,000 cases of encephalitis. After the vaccine was introduced, the number of cases plummeted, and as I said, in 2000, the disease was eliminated in the United States. So people have lost their fear of measles and have focused instead on these claims by this fraudulent paper. And because of this lack of trust now, we've seen a resurgence in measles and other vaccine-preventable diseases. Now, it's much harder to prove, and there have been papers looking at this, and I haven't examined the literature on it. It's much harder to disprove an absence than to suggest the presence of something. So you'd have to do a randomized trial of deliberately providing vaccine for one group of children and not providing vaccine for the other group of children, and then see who develops autism and who doesn't. Unfortunately, that's going to be considered an unethical study in today's day and age. I mean, no medical researcher is going to get institutional approval, human subjects review approval to do such a study because it's considered unethical. But really, the kind of study that you'd want to have done is you take a huge group of children, split them into two groups, give one group the measles vaccine and one group withhold it, and see who develops autism. Mm-hmm. Now, in many cases, the autism is there from birth. And sometimes it's just coincidental when they get the vaccine. But, you have to do a randomized clinical trial to really prove, causation more than just kind of an association. Mm-hmm. And that's going to be an unethical study to do. Mm-hmm. So the best you can do is just look at retrospective studies, looking to see who developed autism and who didn't, but it's going to be much harder to prove or disprove, if you will, mm-hmm. that the vaccine does not cause it.
Mm-hmm. Okay, thank you for this. And I again, we're winding up with a place where it's troublingly impossible to give the really totally satisfying answer that's going to resolve the issue. And that's what I think I'd like to see much more of a debate or discussion that would help clarify this. And let me ask then you both. I'm going to suggest that we actually need lots of whack-a-mole solutions, or at least a very well-developed incident management system. But your book, Laura, focused very much on the politics and the difficulty of leadership, political leaders at any rate, in addressing public health emergencies, whether it be bioterrorism, which thank God is a hypothetical case now, I guess, or more than that, a real outbreak of a pandemic from a new zoonotic disease, etc. What would each of you propose as the most promising whack-a-mole kinds of solutions for the immediate future in reducing the incidence of or the risk of pandemics? And do you agree?
Well, I've had some experience looking at individual countries and their capacity, what I would call their emergency response capacity. And that involves, first of all, detection of the event, and then communicating that event to some level of government or some level of government that has a response capacity. And then the response capacity can actually be implemented. Those are three critical things. And to the extent that a country can detect what we call the signal, the initial cases at a very local level, relay that information in a reliable way to the central levels, and then respond. To the extent that those systems can be put in place, we will be in a far better position to whack them all as fast as possible.
Mm-hmm. Mm-hmm. Okay, Laura?
Well, we live in a microbial world. We need to learn how to live in our microbial world better. We need to educate the public about what living in a microbial world means. We need to understand how our bodies work, how the ecosystems, microbial ecosystems around us work, and why sanitation, clean water, and food safety is so critical, and what we eat is so important in terms of our health and disease. So education, public education, starting in grade school at the very youngest children, is really essential if we want to be able to live sustainably on this planet. Now, that having been said, in terms of dealing with the whack-a-moles, in my studies, there are many leaders involved in pandemic responses, but at the very minimum, the most important is your political leader and your bureaucratic leader, or the person in charge of the incident management system is critical, but so are the political leaders. And people always ask, well, who's in charge? Well, ultimately, it's our elected officials who are responsible for the health and safety of the people that they were elected to serve. And they're often left out of the equation, but they are absolutely essential to get the political support, not only from the public, their political support of what the incident management team is doing. You need to have political support by the politician, and oftentimes it's the politician who's the weak link in all of this for a variety of reasons. Either they communicate, they provide false reassurances to try and tell the public that everything is okay when in fact it might not be, or they might be saying something misleading, or they might really not understand at all what's going on, or they might not put in place the leaders that are needed who are competent to respond. So we really need to focus on who are elected officials. Yeah, they might be a nice person who you want to have a beer with, but are they going to be able to rise up to the occasion and lead the country, provide the leadership necessary to respond to these types of crises? And in many cases, that's not necessarily so. And for example, here in the United States, I have absolutely no trust in my current president, because he just does not have the capacity to lead this country in any kind of crisis. And we are in a very difficult period. So who you elect is critical.
Yeah, Lars, you make a super point. One of the things that we talk about when it comes to implementing the incident management system is we feel strongly that the biggest thing you have to lose in your response to an outbreak of disease is the trust of the public.
Right.
Because you're going to ask the public to do something to help you control the disease. It might be get a vaccination. It might be boil your water. Whatever it is, you're going to ask the public to cooperate. And if the public doesn't trust what you're saying, they're not going to be able to cooperate, and they won't help you stop the outbreak. So where do you get that public trust? Well, you need a leader. You need the leader to step up and say, these people know what they're talking about. They're doing the right things, et cetera, et cetera. And you're right. It is often a weak link. And this is why we talk about who's the best spokesperson to convey the information that things may not be totally under control, that kind of, and to be honest and open with the public and to maintain their trust. And you make an excellent point.
You know, I hate to say it, but you brought me back to exactly the kind of thing that's causing me to lose the most sleep at night. And that is that I'm losing confidence in democracy. I just plain don't believe anymore that our system is working in bringing competent people to office or giving instructions on what we actually want. Because I think a large proportion of the population, if you think about the fact that 40% of the U.S. population still admires and trusts Donald Trump, we've got a problem there. And I think it's a political problem that is, I'm a political sociologist, so that's what haunts me, is the fact that now you're bringing in another example of the fact that we can't even get people who are to bring into office who are competent to deal with public health emergencies.
Well, Metta, you raised some important points. There are certainly challenges with democracy, but I would still prefer it over the other types of government. I really do not
you and Winston Churchill, I think.
Really don't want to live under a dictatorship or have absolutely no say in or representation in what happens in our lives. So, Trump is a symptom of some deep-seated, long-standing problems in the United States. There's no question. We've got serious problems that we have to address, and he was, I think, the shot over the bow of our ship of state by a lot of people who are very unhappy, and their unhappiness has long been ignored. We've got severe income inequality that allowed for a demagogue like him to be elected. And certainly racism has been woven in the thread of our country since the beginning of it. So we indeed have some very serious problems, but I am heartened by the election of all the women in Congress and the House. We've got an increasing diverse representation. And so I'm hopeful that the sleeping giant of most of the people who didn't bother to vote will realize that if you want to keep your democracy, you have to work towards it. And a lot of people have become politically active who've never been politically active before.
Oh, in your book, you contrast you talk about Max Weber's theory that there's a conflict inherently between the bureaucrats and the elected officials.
Right.
And I'm beginning to think maybe we ought to give more power to the bureaucrats. I don't know. Even there, I don't trust any of them. I'm becoming a terribly cynical theorist, but at any rate, there are some people who know a few things, and the bureaucrats presumably are more likely to be experts and are hired for their expertise, just as you both have had positions. I wouldn't call you either one a bureaucrat, but you've been functioning at times in a public organization or governmental structures, making decisions that I think I would trust you before I would trust Donald Trump. Or maybe I would trust you before I would trust, let's say, Bernie Sanders, whom I would have gladly voted for, let's say.
Different people bring different skills, and, the politicians have an ability to connect with people and to hopefully gain their trust. The politicians, the bureaucrats, policy wonks, might not necessarily be as good at communicating.
Okay, well, you and Winston Churchill agree. He, I think, was famous for saying something like, democracy is the worst form of government except for all the others that have ever been tried. Ron, you and I both live in Canada, and we are a democracy and probably don't have quite as many grievances today as Laura does sitting in Princeton. So why don't you and I give her some advice about how to get rid of Donald Trump and install people with good public health policies? What would you do about this matter? And you're going to have the final word.
Well, Metta, do you have about another 3 or 4 hours to talk about this subject?
Once we let Laura go to her meeting.
No, I'm not sure Canada is in a position to give advice to the United States. We have our own issues, and I wouldn't say that. I would say that racism is also an issue in Canada. We have a huge, in my opinion, a racism issue with our First Nations people, who are discriminated against in many ways. Canada is not pristine and perfect, and no place is.
That much we can agree to. And we can also agree on the desirability of vaccines and on the desirability of doing something to cope with this antibiotic resistance. So how many other things there are to agree to, we'll have to work for another day, because it's time to say goodbye. I want to thank both of you. It's been really fun and very, very useful. Appreciate it.
Thank you, Metta. Thank you very much.
Bye. Bye, Laura.
Bye-bye. Thank you, Metta. Bye-bye, Ron.
Bye.
Bye.
This conversation is one of the weekly series Talk About Saving the World, produced by Peace Magazine and Project Save the World. Please visit our website at tosavetheworld.ca, where you can sign the Platform for Survival, a list of 25 public policy proposals that, if enacted, would greatly reduce the risk of 6 global threats to humankind. Come back next week for another discussion of a serious global issue.